Good morning, everyone. Hartford Healthcare Corporation, DBA, HHC Surgery Center Holdings, LLC, Surgery Center of Fairfield County, LLC, and SCA-Connecticut Partners, LLC. The applicants in this matter seek a certificate of need for the transfer of a healthcare facility pursuant to Connecticut General Statute, Section 19A-638, Sub A, Sub 2. Specifically, Hartford Healthcare seeks to obtain the right to appoint and remove 3 of the 5 members of Southern Connecticut, the Surgery Center of Fairfield County's Board of Managers, thus giving it governance control of the Surgery Center. Throughout this proceeding, I'll refer interchangeably to HHC Surgery Center Holdings as HHC, and the Surgery Center of Fairfield as Scfc. Today is September 21st, 2022. My name is Daniel Chuka. Kimberly Martone, the former Deputy Director and the Chief of Staff, and the now current Acting Executive Director of OHS, designated me to serve as the hearing officer for this matter, to rule on all motions and to recommend findings of fact and conclusions of law upon completion of the hearing. Section 149 of Public Act number 21-2, as amended by Public Act number 22-3, authorizes an agency to hold a public hearing by means of electronic equipment. In accordance with this legislation, any person who participates orally in an electronic meeting shall make a good faith effort to state his, her, or their name and title at the outset of each occasion that such person participates orally during an uninterrupted dialogue or series of questions and answers. We ask that all members of the public mute the device that they are using to access the hearing and silence any additional devices that are around them. This public hearing is held pursuant to Connecticut General Statute, Section 19A-639A, Sub E. As such, this matter constitutes a contested case under the Uniform Administrative Procedure Act and will be conducted in accordance therewith. The Office of Health Strategy has some staff with me here to gather some facts related to this application, and will be asking the applicant witnesses questions. I'm going to ask that each staff person assisting with questions today identify themselves with their name, spelling of their last name, and OHS title. And I'm going to start first with Steve Lazarus.
Good morning. My name is Steve Lazarus. Last name is spelled Lazarus, and I'm the Certificate of Needs Supervisor.
Thank you. And Annie Fiella.
Good morning. My name is Annie Fiella. Last name is spelled F-A-I-E-L-L-A, and I am a planning analyst at OHS.
Thank you. Also present is Maida Capozzi, spelled C-A-P-O-Z-Z-I. She's a staff member for our agency, and she's assisting with the hearing logistics. And will also gather the names for public comment if there are any names during the sign-up period. The certificate of need process is a regulatory process, and as such, the highest level of respect will be accorded to the applicants, members of the public, and our staff. Our priority is the integrity and transparency of this process. Accordingly, decorum must be maintained by all present during these proceedings. This hearing is being transcribed and recorded, and the video will also be made available on the OHS website and its YouTube account. All documents related to this hearing that have been or will be submitted to OHS are available for review through the Certificate of Need portal, which is accessible on the OHS.com webpage. In making my decision, I will consider and make written findings in accordance with Section 19A-639 of the Connecticut General Statutes. Lastly, as Zoom notified you in the course of entering the hearing, I wish to point out that by appearing on camera in this virtual hearing, you are consenting to being filmed. If you wish to revoke your consent, please do so at this time. The CON portal contains the pre-hearing table of record in this case. At the time of its filing, exhibits were identified in the table from A to T. I also noticed that one public comment was received this morning, and I believe that has also been uploaded. So that'll be referred to as Exhibit U. I sent that to council not that long ago, about 20 minutes ago. I don't know if she's had an opportunity to hear it or to review it, but we can address that once we get to it.
Absolutely.
So Ms. Fiala, other than what I just mentioned in terms of the public comment, do we have any additional exhibits to enter into the record at this time?
No, we don't. However, OHS does plan to upload an excerpt from the all payers claim database once it's received from staff and Medicaid data is removed.
Okay, thank you. So that's similar to what was done in the hearing last month. Is that correct? Do you know, Steve?
Yes, yes,
Okay.
exactly that.
Okay. So the applicant is hereby noticed. Actually, before we get into that, let's talk about the exhibits. Attorney Fusco, do you have any objections to A through T? That doesn't include the public comment.
Okay, good morning. This is Jennifer Fusco, counsel for the applicants. I don't have any objections per se. I just did want to point out a couple things for the record. In terms of the applicants in this matter, HHC Surgery Center Holdings LLC is not a DBA of Hartford Healthcare Corporation. It's a subsidiary. Hartford Healthcare Corporation itself is not an applicant to this matter. So that applicant should simply be HHC Surgery Center Holdings LLC, which is a separate legal entity.
Okay.
And then obviously with respect to the public comment, I mean, I see it in the record. I have not had a chance to review it. It was submitted by a doctor who is affiliated with Wilton Surgery Center, which was an intervener in a prior hearing involving Hartford Healthcare Surgery Center. So I would like an opportunity to review it and determine whether we want to respond to this. And then I also just wanted to note for the record, to the extent that anything's going to be put in from the all payer claims database, we would like an opportunity to review, potentially respond and discuss, sort of as we are in other matters, the confidentiality of that data. So other than that, no objections or comments on the record.
Okay. So I'm going to enter exhibits A through T as full exhibits then, subject to what you just brought up in terms of HHC Surgery Center Holdings being the actual applicant here and not Hartford Healthcare Corporation. And also subject to your other requests that you be provided with an opportunity to respond potentially to Exhibit U, as well as
The all payer claims database.
oh, yeah, the all APCD, sorry.
That's okay.
Blanked on that for a moment. So in addition to those, the applicant is hereby noticed that I am taking administrative notice of the following documents: statewide healthcare facilities and services plan, the facilities and services inventory, the OHS acute care hospital discharge database, and the all payer claims database claims, which it sounds like the excerpt is taken from that. But we will, of course, provide that as a late file of our own. I'm also going to take administrative notice of the following dockets. I don't know whether I'm going to actually base my decision at all on these, but they are similar in nature, so it's possible that things may come up in them that I think are relevant. So one is docket number 20-32411. That's the hearing that took place last month concerning Southwestern Connecticut Surgery Center. In addition to that is docket number 21-32445, which is the docket for the application filed by Litchfield Hills Surgery Center, HHC Surgery Center Holdings, and HHC Litchfield Hills Surgery Center. Attorney Fusco, do you have any objections to the documents or the dockets that I just took administrative notice of?
With respect to the dockets, I mean, I just want to put a general objection on the record. I know you said you might not use them, but these are three separate CON applications for three different centers based on different sets of facts and circumstances. So just a little bit concerned about how information in one might be used in another. So I want to put a general objection into the record with respect to that. And then with respect to the databases, the all payer claims database, the discharge database, again, we would ask, to the extent the agency is going to use information from those databases that we don't have access to in support of a decision, we would like to be provided with that information in advance of the agency's use of that information so that we can review it and respond if necessary.
Okay, thank you. Your objections are noted. I am going to overrule your general objection on the administrative notice simply because I'm
Understood.
I'm unlikely to use it, but there may be something that comes up.
Understood.
I may also take administrative notice of the hospital reporting system. That's the HRS financial and utilization data, and also other prior OHS decisions, agreed settlements, and determinations that may be relevant. And Attorney Fusco, do you have any objection to that last one?
Same as, with respect to the hospital reporting systems data, the same comment I had with respect to data from other databases. We'd like an opportunity to review and respond.
Okay. So Attorney Fusco, do you have any additional exhibits that you wish to enter at this time?
We do not.
Okay. Then we will proceed in the order established in the agenda for today's hearing. I would like to advise the applicants, as I always do, that we may ask questions related to your application that you feel have already been addressed, either in the application or in any of the supplemental responses. We will do this for the purpose of ensuring that the public has knowledge about your proposal and for the purpose of clarification. I want to reassure you that we have reviewed your application, completeness, responses, and pre-filed testimony, and we will do so again before issuing a decision. As this hearing is being held virtually, we will ask that all participants, to the extent possible, enable the use of video cameras when testifying or commenting during the proceedings. All participants shall mute their devices and should disable their cameras when we go off record or take a break. Please also be advised that although we will try to turn off the hearing recording during the breaks, it may continue. If the recording is on, any audio or video that has not been disabled will be accessible to all participants. Public comment taken during the hearing will likely go in the order established by OHS during the registration process. However, I may allow public officials to testify out of order. I or OHS staff will call each individual by name when it is his or her turn to speak. Registration for public comment will begin at 2 p.m. today and is scheduled to start at 3 p.m. If the technical portion of this hearing has not been completed by 3 p.m., public comment may be postponed until the technical portion is complete. The applicant's witnesses must be available after public comment, as OHS may have some additional follow-up questions based on the public comment itself. Before we get too far into things, I did actually have one other question for you, Attorney Fusco. It's sort of a housekeeping matter. The submissions refer to the third applicant as SCA-Connecticut Partners, LLC, and lists Surgical Care Affiliates, LLC as the parent company. I went into the business entity search for Connecticut and I didn't find SCA-Connecticut Partners, LLC. Is that the actual name or is that a DBA or?
That is the actual name. I'm not sure if it's a Connecticut company. I mean, that is the entity that owns a majority of Surgery Center of Fairfield County LLC, right? It's the parent directly above the licensee that owns 51% of it.
Okay.
And I'm not sure if it is a Connecticut. We can verify for you, but.
Okay, I was just curious. I wanted to make sure that, I mean, you pointed out Hartford Healthcare Corporation is not being the applicant. I wanted to make sure we had that correct as well.
Yeah. And I think we included SCA Connecticut as an applicant here because what the proposal is for is a change in governance control, and it's going to be changing at that level and then impacting the licensee board, right? So that's why we included them.
Okay, understood. Thank you. Are there any other housekeeping or procedural matters that you wanted to discuss at this time?
Nope. Thank you.
Okay. So is there an opening statement that you would like to present?
Sure. Give some opening remarks before our witnesses testify. Thank you again for giving me the opportunity to provide an opening statement, and thank you, Attorney Chuka, and your staff for the time here today and the time you've taken to review our submissions in preparation for this hearing. We do hope that the testimony we're going to provide here today, along with what we've submitted in writing, helps the agency understand better the benefits of the proposed transfer of governance and control of Surgery Center of Fairfield County to an HHC affiliate, and how a joint venture between these two exceptional healthcare organizations favorably impacts things like access, quality, care coordination, health equity, and the cost effectiveness of outpatient surgical services for all residents in the greater Bridgeport area. Just by way of brief background, and this will come up in testimony, Surgery Center of Fairfield County is not a new center. It's been around for, I think, nearly 40 years now. It was in Bridgeport at one point in time and has moved to Trumbull, and it has had various different names over the years, but it has been serving that community for decades. The center has a robust medical staff. I think you'll hear testimony maybe up to 80 physicians on the medical staff. Many of those physicians hold privileges at HHC acute care hospitals, including St. Vincent's Medical Center in Bridgeport. Surgery Center Fairfield County, has historically and continues to participate with Medicare, Medicaid, most commercial payers, and they're obviously licensed, certified, and accredited. The center is currently managed and controlled by SCA Health, which was formerly known as Surgical Care Affiliates. So, having looked through things in the OHS history, you probably see this company referred to as SCA. They've rebranded as SCA Health. SCA Health owns and operates now more than 300 ASCs nationwide, including, I believe, 8 or 9 in the state of Connecticut. And you're certainly familiar with HHC, which is the parent company to a clinically integrated health system that includes acute care hospitals, an ambulatory network, a multi-specialty medical group practice, among other offerings. I believe you're also aware that HHC is involved with numerous joint ventures around the provision of outpatient surgical services, including being a partner in a number of multi-specialty ASCs, as well as those focusing on single surgical subspecialties. So one of the questions we're here to answer today for OHS is why a facility like Surgery Center of Fairfield County, which is operated by an experienced and capable company like SCA Health, needs to partner with HHC. And the answer to that question lies in the value that comes from an ASC joint venturing with a clinically integrated health network. The model that the applicants are proposing is not a novel one, right? There are many joint ventures, ASCs around the state involving some combination of physician, hospital, health system, management company ownership. And the parties to these types of joint ventures typically come in offering complementary expertise, right? And they bring tremendous value to the facility that neither party can bring on its own. And that's why they come together and combine. And in doing so, they drive efficiencies that benefit consumers, namely patients and payers. You're going to hear testimony today from Donna Sassy, who's with us remotely, HHC's Vice President of Partnership Integration, about the many benefits of fully integrating an ASC into a health network. She's going to testify about the ways in which being part of the HHC network in particular promotes access, quality, care coordination, and cost effectiveness, from seamlessly arranging for pre and post-surgical care for complex patients, to sharing the cost of implementing a common electronic medical record, to collaborating on evidence-based best practices, just to name a few. And Donna will certainly go through a more exhaustive list. But this idea of full clinical integration shifts an ASC like the center from one where care is delivered to one where care is coordinated and managed. And that's a really important distinction and the reason for these types of partnerships. And this kind of coordinated and managed care can't be accomplished in an unaffiliated ASC or one that isn't affiliated with an integrated health system to the same way it can with a health system partner like HHC. So while SCA Health excels at the day-to-day management center, the ability to integrate Scfc into a clinical network and to provide this coordinated rather than fragmented care across an entire spectrum of health services provided by HHC only comes with this proposed affiliation. You're also going to hear from Gina Mondo, Vice President of Operations for SCA Health, about the center's relationship with HHC and how it's already enabling the transition of certain higher acuity cases from a more costly hospital setting to a lower cost ASC setting, which reduces the cost of healthcare and facilitates more cost-effective care delivery. This is a purposeful migration of procedures from hospitals to ASCs, and it's a trend being seen kind of nationwide across surgical subspecialties. I'm sure you're familiar with it in orthopedics, because I know we talked about that in a different hearing. And, you know, definitely there are orthopedic procedures moving, but this is a multi-specialty facility, and Gina can tell you a little bit about other types of procedures that are shifting as well. This trend is being promoted by payers primarily, who are looking to reduce healthcare costs by directing their members to the most cost-effective, clinically appropriate settings for their care. And the migration that we're seeing of cases to Surgery Center of Fairfield County is really only possible because HHC is able to provide this clinically integrated care to more complex patients. And, you know, importantly, because surgeons and patients have confidence in HHC, and they're comfortable sending patients to this facility if they know it's a facility that HHC is involved with and that it intends to control subject to regulatory approval. And so then finally, you may have questions about why governance control is necessary in order to accomplish the objectives of full clinical integration of the center. As you'll hear today, governance control ensures that HHC's perspectives will be heard and considered in a way that's not entirely possible without control, right? It does foster a balanced approach to decision-making. Physicians are still heard, and SCA Health as a manager and a minority owner with a minority number of board seats will still be heard, but it really allows HHC to have a seat at the table when we're talking about decisions of consequence that impact patient care coordination, quality, and safety. And again, Ms. Scsc can talk to you about some of those today. Having that governance control also ensures to the greatest extent possible that the center's policies and priorities align with HHC's mission and vision, which is critical for a nonprofit health system, and that HHC is able to prioritize investments in this center. So although the equity buy-in, that is the non-controlling equity buy-in that has already occurred, works together with the change in governance control to move the center toward clinical integration, you really can't accomplish that, what I'll call full clinical integration, without the governance control to ensure that, you know, patients benefit from the integration. So HHC and SCA Health are really just asking OHS for the same consideration that's been given to many ASC joint ventures in this state that have been approved by this agency and by your predecessor agency, and that are now operating for the benefit of their patients. As I mentioned at the outset, this model is not a new one. It's been proven to work in other centers, including other HHC joint ventures, and to enhance care coordination, quality, access, equity, and to bring value. It's clear from the CON submissions and from the testimonial here today that the proposed change in governance control of Surgery Center of Fairfield County will accomplish these same objectives. And as such, it meets the criteria for issuance of a CON. So with that, I'm going to turn the presentation over first to Ms. Mondo and then to Ms. Scsc. I don't know how you want to swear them, given that they're in different places, if you want to do it individually.
Yeah, I think individually makes the
Okay.
most sense. So you're going to start with Ms. Mondo, you said? Okay.
Yes.
So Ms. Mondo, if you can just introduce yourself and spell your last name, and then state your title.
Sure, I'm Gina Mondo, last name spelled M-O-N-D-O, and I'm the Group Vice President of SCA Health.
Okay, thank you. Please raise your right hand. Do you solemnly swear or solemnly and sincerely affirm, as the case may be, that the evidence you provided in your pre-filed testimony and the evidence you shall give or have already given in this case shall be the truth, the whole truth, and nothing but the truth, so help you God, or upon penalty of perjury?
I do.
Thank you. And do you adopt your pre-filed testimony?
I do.
Thank you. You can proceed.
Great. Good morning, Attorney Chuka and members of the OHS staff. My name is Gina Mondo, and I'm the Group Vice President for SCA Health, with responsibility for our company's ambulatory surgery centers in Connecticut. I adopt my pre-filed testimony. Thank you for this opportunity to testify in support of the Certificate of Need application filed by Surgery Center of Fairfield County, SCA-Connecticut Partners, and HHC Surgery Center Holdings for a change in governance control of Surgery Center of Fairfield County. and SCA Health Hartford Healthcare Joint Venture ASC. The focus of my remarks today will be on the center and its current operations. I will also offer some background on SCA Health and our philosophy regarding health system joint ventures, which we are a part of in many states across the United States. I will also discuss the benefits of Hartford Healthcare Surgery's equity investment in Scfc, as well as its assumption of governance control we'll have for the facility and our patients. In particular, I will focus on the cost effectiveness of the proposal and the benefits that we are already gaining from the coordination of care and migration of cases previously performed in a more costly hospital setting to the lower cost ASC setting. Surgery Center of Fairfield County is a duly licensed multi-specialty ASC located in Trumbull. It offers surgical services and specialties including ENT, general surgery, gastroenterology, gynecology, ophthalmology, oral surgery, orthopedics, pain management, plastic surgery, podiatry, and neurology. SCFC participates with Medicare, Medicaid, and most commercial payers and is accredited by the Accreditation Association for Ambulatory Healthcare. Pending CON approval, HHC Surgery, a wholly owned subsidiary of HHC, will obtain the right to appoint and remove 3 of the 5 members of the FCFC Board of Managers, giving it governance control of the center. The proposed change in governance control of FCFC follows an equity buy-in by HHC Surgery to the majority owner of FCFC, SCA-Connecticut Partners, in June of 2021. SCA-Connecticut currently owns 51% of Surgery Center of Fairfield County, with the remaining 49% owned by individual physician investors. Both SCFC and SCA-Connecticut are indirect subsidiaries of United Health Group, a publicly traded company that, by and through its subsidiaries, operates a diversified family of businesses dedicated to helping people live healthier lives. SCA Health is a part of United Health Group's Optum business line. SCA Health has 45 plus health system partnerships across the country, which create community-based benefits for patients, physicians, and health systems. For patients, these benefits include access to convenient, high-quality, lower-cost surgical care, and the ability to go to an outpatient facility that is aligned with their preferred hospital or physician network to promote continuity of care. As Ms. Sassy will testify, Hartford Healthcare is a parent company to an integrated healthcare delivery system and is involved with numerous joint ventures around the provision of outpatient surgical services. These include multi-specialty centers like ours, as well as centers that focus on surgical subspecialties, including ophthalmology, orthopedics, and gastroenterology. Hartford Healthcare has significant experience and a proven track record as a partner in joint venture outpatient surgical facilities, and it will bring enhancements in quality, patient management, reporting capabilities, care coordination, and access for Surgery Center of Fairfield County patients. Obtaining governance control will allow HHC Surgery, which already owns a majority of the membership interest in Surgery Center of Fairfield County, to have a say in all significant decisions that impact the facility and its future direction. Having governance control will provide a more balanced approach to decision-making that will factor in different industry knowledge and perspectives to ensure that the best decision for the center and ultimately the quality of care for the patients it serves can be implemented. Ms. Sassy will provide you more details on why the change in governance control will allow for full clinical integration of Surgery Center of Fairfield County into the HHC system of care, and how this will enable a level of care coordination and management that SCA Health cannot provide on its own, and that will be a tremendous benefit to our patients. Hartford Healthcare brings the resources and capabilities of an integrated health system, which will allow the center to advance quality initiatives and drive cost-effective care in a manner not possible to achieve without this type of partnership. In addition, HHC's capital is available to finance the purchase of new equipment and state-of-the-art technology to help ensure the center remains high-quality, cost-effective alternative for outpatient surgery in the region. With respect to cost effectiveness, Surgery Center of Fairfield County and Hartford Healthcare are actively facilitating the migration of surgical procedures from hospitals to the ASC. Between September of 2021 and July of 2022, the center performed nearly 240 surgical procedures across subspecialties that would otherwise have been performed in the more costly HOPD setting, resulting in a savings of approximately $790,000. As previously noted, migration of patients to lower cost ASC settings is being promoted in part by payers who are looking to reduce healthcare costs by directing their members to the most cost-effective, clinically appropriate setting for their care. ASCs are also a more efficient care setting generally. ASCs reduce costs for employers, payers, and the healthcare system as a whole. Any proposals such as this, which will strengthen an existing ASC, should therefore be considered a proposal that enhances the cost effectiveness of care. Thank you again for this opportunity to testify in support of the applicant's request to allow HHC Surgery to assume governance control of Surgery Center of Fairfield County and the center. Through our hearing testimony and CON submissions, applicants believe that we have met our burden of demonstrating the proposal's adherence to the CON statutory decision criteria. This proposal will result in enhancements to quality access, care coordination, and health equity to help to maintain and grow a cost-effective care alternative, all to the benefit of patients in the greater Bridgeport area. For these reasons, we respectfully request that OHS approve our CON application. Thank you again. I'll now turn the presentation over to Ms. Sassy. Once she testifies, we're available to answer any questions you may have.
Okay, thank you, Ms. Manda. Ms. Sassy, can you please identify yourself for the record, including the spelling of your last name and your title?
Yes, good morning, Attorney Scact and members of the OHS. My name is Donna Sassy. I'm the Vice President of Partnership Integration for Hartford Healthcare Corporation. My spelling of my last name is Sassi.
Okay, thank you. Can you please raise your right hand? Do you solemnly swear or solemnly and sincerely affirm, as the case may be, that the evidence you provided in your pre-file testimony and the evidence that you shall give or have already given in this case shall be the truth, the whole truth, and nothing but the truth, so help you God or upon penalty of perjury?
I do.
Thank you. And do you adopt your pre-file testimony?
Yes, please.
Thanks. You can proceed whenever you're ready.
Thank you for this opportunity to speak in support of the Certificate of Need application for a change in governance control of Surgery Center of Fairfield County and HHC SCA Health Joint Venture Ambulatory Surgery Center. My testimony today will focus on HHC's affiliation with the center and how the relationship enhances the quality of outpatient surgical care, care coordination, access to care, and health equity for the residents of the greater Bridgeport area. Hartford Healthcare is the parent company to an integrated healthcare system, including acute care hospitals, an ambulatory network, a behavioral health network, a multi-specialty medical practice, home health and independent living care, as well as a senior living communities. In my role as Vice President of Partnership Integration for HHC, I ensure that we build sustainable and scalable integration throughout our regions and institutes through standardization of practice, providing consistently excellent patient experience, and by focusing on health equity, quality, and safety. Through HHC's alliance with Scfc and other ASCs across the state, HHC is investing in updating care processes in order to provide efficient, high-quality, equitable healthcare delivery close to home in the communities where our patients live. HHC is shifting from a model of care delivery to one of care coordination and management through its investments in updated care processes that are available to the providers at the point of care. This paradigm of care that ASCs offers provides the value-based option for the patients and payers. As OHS is aware, this CON application is for a change in governance control of Scfc following a non-controlling equity buy-in by HHC Surgery. A change in governance control of Scfc is necessary to accomplish the objectives of full clinical integration. It will ensure that HHC's perspectives are heard and considered in a way that's not possible without such control. Governance control is necessary to ensure that decisions impacting patient care are consistent with HHC's mission and vision to improve quality of care, care coordination, and to provide local access at a lower cost to the patients. Further, the governance control ensures that we have a voice that advocates for the patient. HHC has the resources to manage all appropriate populations having surgery at the center, especially as the surgeries at the ASCs are becoming more complex, and we are the system that have the resources to manage that clinical risk. My written testimony includes details regarding initiatives that HHC has taken in its partner ASCs on our journey for them to become optimally integrated. I would like to highlight a few examples of how HHC, with governance control of an ASC, uses its resources to better manage and coordinate care. As these new procedures, as I previously said, are being undertaken at the ASCs, they're more complex, and the patients are older and likely to require increasingly intense medical management prior to and after surgery. In the Fairfield area, we have a growing population of 65 and over. Participation in HHC's integrated healthcare network enhances care coordination by seamlessly coordinating pre and post-surgical care that these patients require. It's no longer about the surgical episode alone. It's about managing the patient along the continuum of the health journey. We also, in order to be fully clinically integrated, we need to share information, and the platform that Hartford Healthcare has chosen is Epic, and that we work with our ASCs to be able to share the costs of going live with full Epic, or to provide them Epicare Link, which is a view-only option for the provider. But what this IT infrastructure does is provide the details that the physician needs to manage the patient real time. Pre-admission testing, we offer the ambulatory surgery centers the ability to send patients to our ambulatory, our pre-admission testing. We have practitioners there that are able to do a health assessment, and that they collaborate with anesthesia to do a anesthesia plan for that patient that's specific to that patient. We also want to make sure that we're providing excellent care, and we do that through making sure that we have our competencies. For example, our provider competencies are the best that they can be. Hartford Healthcare has rolled out the Resuscitative Quality Initiative, which is a American Heart Association program. It is specific to CPR skills. The studies show that less than 30% of the way we provide CPR today is effective. That means that we save a life, less than 30%. And Hartford Healthcare invested in that technology and platform to make sure their providers had the best training and their staff who provided CPR. We are able to influence and encourage the ASCs or SCFC to roll out this program to be consistent, once again, with our mission and vision of high quality care for our patients. We also have been able to support during crisis management, COVID, the pandemic, over the last 2.5 years, our ASCs, patients put off healthcare, and we, because of the pandemic, whether it was due to they couldn't get access to have the surgery, it might have, been delayed. We worked with our ASCs to provide them the education for both their physicians, their staff, and the patients on what COVID was, how to manage themselves, the PPE, everything related to COVID. And we were able to provide them access, the patients, the providers, to immunization, to testing sites. And that couldn't have been done without Hartford Healthcare as a system having those resources available. And the positive impact to the ASC was that those patients could move forward with getting their surgery that was impacting their life, so that we improve the patients' well-being by being able to support the ASCs in that way. As far as adopting best practices, true clinical integration, we need to share the best protocols, evidence-based. We have an institute model at HHC. They are the experts in their field, and they drive our protocols and best practices. We disseminate them into the ASCs. We work very closely to make sure that there's standardization of care, that a patient can walk into any door that we're affiliated in, and that they get the same level of care that is provided at the acute care side. OHS is aware of the quality benefits generally that flow from receiving care in ASC. These benefits should be considered when evaluating any proposal, such as the one before you, that really strengthens an existing ASC and enhances its ability to coordinate and manage patient care. ASCs derive their advantages from being specialized facilities that exclusively perform surgical procedures. Through this specialization, ASCs can focus on delivering a higher level of patient safety and quality outcomes by lowering readmission rates, lowering reoperations and revision surgeries, and reducing risks of surgical site infections, which are a source of more than $3 billion in avoidable healthcare costs. So the option of an ASC offers those clinical quality advantages. ASCs also tend to have fewer acutely ill patients for others to come in contact with, thereby lowering the risk of spreading any kind of contagious diseases. Lastly, HHC's partnership with Scfc will enhance access to care for all patient populations and promote health equity. The participation of a non-for-profit health system in the Scfc joint venture ensures that patients will continue to be served in a non-discriminatory manner and regardless of payer source or ability to pay. Scfc participates with Medicaid and will continue to do so if HHC surgery obtains governance control of the center. In addition, Scfc will provide charity care to those in need consistent with HHC's financial assistance policy. Thank you again for this opportunity to testify in support of the CON application that requests to allow HHC surgery to have governance control of Scfc. Our testimony and CON submission have demonstrated how an HHC partnership will improve the quality, accessibility, equity, and cost effectiveness of the care at Scfc. For these reasons, I respectfully request that you approve our CON request. At this time, we are now available for any questions.
Thank you, Ms. Sassy, and thank you for being available despite being out of the office. So I and I'm sure the rest of OHS staff appreciate that. Attorney Fusco, did you have any questions that you wanted to address to your witnesses before we moved on to OHS?
No specific questions at this time, but if possible, once you've asked questions, if I can have an opportunity to redirect, I would appreciate that. Thanks.
Certainly, that's fine. Annie, Steve, do you guys have any questions?
We'll start with Annie first.
Okay.
Good morning, all. So I just have a couple of questions. So my first question is, when was Scfc established?
The facility was established in 1985, previously at a different location.
What location was that?
That was located in Bridgeport, Connecticut.
And if I can just add it had a different name to at that time. I think it was called Health South Surgery Center of Bridgeport.
Okay. And then when did it move then?
It relocated approximately 8 years ago to the Trumbull location.
When did SCA become affiliated with Scfc?
I'm not sure I know the exact date.
I mean, it's a legal question. So this came out, the facility was owned originally by Health South, which spun off its surgical division, I believe in 2007, and created surgical care affiliates, right? So they just kind of transitioned from Health South to SCA. And there are, I believe the year was 2007, and there are CON decisions by the Office of Healthcare Access that approved that could give you the exact date, or I could get you those docket numbers if you need them.
Okay.
I would appreciate that. I'm curious how long SCA has been affiliated, that's all.
The next question is, why isn't SCA interested in maintaining governance control?
Yeah, so I think for us, as we evaluated this partnership in conjunction with our physicians, we really recognize the value that Hartford Healthcare would bring to the facility, and primarily being a part of their clinically integrated network that is continuing to evolve. And so we understand that, in order to reap the benefits of being a part of a clinically integrated network, that Hartford has to have that governance control. And again, that's the primary reason why we wanted to move forward with this type of relationship with Hartford.
So why did HHC Surgery take the step of acquiring 70.59% of the membership interest in SCA-CT, obtaining 36.0009% indirect ownership interest in Scfc in the process prior to filing this application?
So, I mean, we, in conjunction with the law, we moved forward with the equity transaction. That it was mostly driven by our physician partnership. I mean, there was definitely a lot of interest to have Hartford Healthcare come in as a partner in this facility. And I think it showed that they were committed to being involved with us. And we were going to take the appropriate measures to apply for the change of control.
So in this application, HHC anticipates to maintain its 36.00009% indirect ownership interest in Scfc, but not obtaining the right to appoint and remove the 3 of the 5 members of Scfc's board of managers. So just to clarify, if no change to the board of managers was proposed, but HHC was seeking to obtain a 51% ownership interest of Scfc, would the applicants have applied for a CON?
I'm not sure Gina can answer that. I mean, I think that's a legal question. I mean, are you asking if the acquisition was made at the licensee level? I'm not sure I understand the question. Or are you saying that if we weren't going forward with the change in control, would we have applied for a CON?
Second part.
Okay, sorry. I mean, I think, and again, this gets to the legal issue. I mean, I think, we made a legally authorized non-controlling equity transfer. So if that's all we were going to do, we wouldn't have needed to apply for the CON. But I think there was an understanding here that it was always our intent to then, follow up soon thereafter and move forward for change in governance control.
So in the application, page 18, the applicant states SCA will continue to manage the center going forward. If SCA is being permitted to continue managing operations, why does HHC need the right to control 3 of the 5 members of the board of managers?
So the control, again, is mostly tied to being able to be a part of the Hartford Healthcare clinically integrated network. And so I think SCA will continue to run the day-to-day operations of the facility like we have been all along. But there is some added value, obviously, that Hartford brings, I think, some complementary expertise in running the facility. But again, at the board level, it's important that, Hartford is able to be aligned with their mission and vision. And again, truly have this center be seen as a core part of their clinically integrated network, both from, a technology perspective, clinical policies, procedures, and other things that, constitute clinical integration.
Right, and the impact of Hartford Healthcare not having that decision-making really impacts patient care. If we can't decide and support the rollout of EPIC information data, discrete data elements that follow the patient at the point of service, we're not doing the patients, we're doing the patients a disservice. It's not good care. We understand that, like, there's research out there that it's fragmented. If you stand alone with an episode of care that is totally unconnected to a bigger system that could support the patient once again through their life and through their journey, medical journey.
How many providers at Scfc are part of the HHC network already? So how many have privileges at HHC affiliated hospitals also? St. Vincent's, for instance.
Yeah, I don't have the precise number, so we're happy to follow up with an exact, but we have at this facility approximately 80 physicians that are on our medical staff. I would say, there's a good portion of those that do have privileges at St. Vincent's Hospital. Many of our providers are actually duly credentialed, and so they have hospital privileges at multiple, but we can certainly follow up with an exact number.
Sure. So as a late file, we are looking then for information about the physicians currently practicing at the surgery center, including the total number, their names, their specialties, and their employment status.
Can I clarify? Because I know we had this question in another, as far as employment status, like none of these physicians are, well, I mean, correct me if I'm wrong, Gina, employed by SCFC. They're members of the medical staff. Is that what you're looking for? Just that distinction?
So for example, we're looking for employee or professional service agreements, et cetera.
Okay.
So since obtaining a 36.00009% indirect interest in Scfc, have any of the following improvements already been initiated? The first one, enhanced access to primary care and specialty clinic services through integration with HHC physicians and collaboration with HHC institutions.
So this is Donna. Any of our partners have access to any of our services. So I would say yes, whether they utilize them, we can't follow or track that patient because once again, we don't have information technology that is talking to each other at this point.
Okay. So that's number one. There's a couple of for those. Number two is greater ability to retain, develop, and attract the best clinical talent as part of a locally focused integrated system of care.
The surgeons that are coming out of school definitely are looking for a healthcare system that has that option to work in and to, as part of Hartford Healthcare's corporation. Or so they are looking for that opportunity. It is something that attracts them as well as retains them. These are all physician-driven centers. Obviously, they partner with SCA to run the operations, but certainly they have a vested interest and are engaged.
So is there any evidence, I guess, that since HHC has become affiliated with this facility that there has been a greater ability to retain, develop, or attract clinical staff at the facility?
Yeah, Gina, Gina, I think can answer
Yeah,
this too if you
okay.
want.
Yeah, I'm happy to jump in. So, yeah, I would say, I mean, our retention rate since we've partnered with Hartford is essentially 100%. I do think, you know, some of the added benefits that our physicians were very interested in through this alignment is, you know, Hartford's depth and relationships in the market with local nursing programs and surgical tech programs far exceeds anything that we had as a standalone. And so I think it's also about the continued development of the pipeline, just given the clinical kind of staffing crisis that many of us are experiencing.
Just to follow up on that, in comparison, what was the facility's turnover rate, if you happen to know, prior to HHC's involvement?
I don't have that readily available, but it's something we could certainly follow up on. I would say, yeah, and I would say generally, I mean, the delta, I don't think is going to be significant. I think this center, you know, we've got a good core group of teammates that have worked there for, you know, we've got some good tenure there, but we can certainly follow up with retention or turnover rates.
Would that be helpful, Annie, Steve?
Yes, it'll be good to have as evidence.
Okay.
Yeah, and I think the last thing I'd add on that point is the retention's one piece of the equation. We've actually have had to hire some additional staff since the inception of this relationship, just because we've been able to migrate a significant amount of cases out of the hospital outpatient arena into our facility. So it's actually has led to having to grow our staffing.
And, you know, that out migration that we're supporting the physicians on picking the right patients and to migrate over to those centers based on the guidance from CMS and other payers. You know, really it's at the detriment financially to Hartford Healthcare, but we're doing it because it is the right thing to do for the patients. And we want to provide that low cost option for both our patients, our payers, and quality option.
Okay, to continue on from the question of have any of the following improvements already been initiated? The enhanced ambulatory service offerings, allowing patients to receive care close to home in the most appropriate and convenient setting.
Can I just ask you to repeat that question again? I apologize.
Of course. So since obtaining the 36.0009% indirect internship in interest in SCFC, have any of the following improvements already been initiated? And the improvement is enhanced ambulatory service offerings, allowing patients to receive care close to home in the most appropriate and convenient setting.
Yes, we have realized that by once again, the physicians choosing cases guided by, you know, the payers and moving them safely over, and, you know, Hartford Healthcare assisting with that transition. And, you know, in doing so, we not only impact positively those patients because they're receiving that high quality care, but they are afforded that option. But in the acute care hospital, we're able to meet the demand of the more acutely ill patient that should have the care within an acute care hospital.
Yeah, and just one thing to add to that, I think, you know, we're early in our evolution with Hartford Healthcare, and so I think there's a lot more value to be realized on this front, that as we become more closely aligned to their clinically integrated network, we'll be able to reach more patients closer to home.
Okay. So going on. So have any of the following improvements already been initiated? The integration with HHC's robust care coordination services, which have demonstrated success in providing the most cost-effective care to patients through transitions across multiple care settings and improving outcomes through the prevention of repeat visits and post-procedural hospitalizations.
In my opening talking points, I was able to share with you our pre-admission testing center, where we do allow access for our ambulatory surgery center patients to be optimized prior to surgery, thereby improving the quality of care pre and post surgical surgery.
So
Yeah, and I think oh, sorry, you can jump in there.
I just wanted to ask you a question about the testing center. Can you sort of describe that better? Like,
Yeah.
is it located near the surgery center, or how does that work?
We have several of them. There is one located close to the Trumbull site, and it is at the St. Vincent's Hospital.
Okay.
And so they are allowed to come on campus. They go directly on the first floor right to the pre-admission center. They work with a independent practitioner who's trained and skilled to do the pre-op assessment, and once again collaborates with anesthesia to develop that anesthesia plan of care.
Okay, thank you.
And that includes, and just not to minimize that assessment, that includes getting connecting them to specialists, whether it be cardiac cardiology or any other specialty expert that they might need prior to surgery. But also if there's something that happens during surgery, patient's heart rate goes up, it's a new event, they have the ability to access post as well.
Okay.
Yeah, and the last thing I would add on this front, as far as the care coordination piece, is, one of the, in anticipation of the Hartford having governance control, is actually moving the facility over to the Epic platform, which I think is going to be a critical piece in just the continuum of care and the coordination of care. And so that, that is something that is going to be a key element of clinical integration that we plan to move forward with once Hartford assumes governance control.
I think you mentioned earlier there are two different options for Epic. You can have the ability to actually edit a medical record, or you can just have the opportunity to review the medical record. Does the surgery center have either capability at this point?
Yeah, we do have read-only access, but that certainly has some limitations tied to it. And so obviously from a clinical integration perspective, it would be best to actually be on Hartford's instance of Epic.
Right.
Okay.
And then the last question for this the last subset question for this is, so again, have any of the following improvements already been initiated? The last one is greater access to resources and capabilities necessary to advance population health initiatives and to improve overall health status of the community.
I think that through the pandemic, we were able to help improve the health of the community by, educating them, once again, providing them access. All of the ASCs were, collaborating with us on that. So I do feel that this is an example of one of our ways that we were able to improve the health of our communities. We also, once again, have all those resources available. And by managing the patients, we are managing their health and wellness. And so by that, through our specialists and through our access points in the communities, Hartford Healthcare has built a comprehensive or is building a comprehensive ambulatory network within the communities in which these patients live, so that we are, managing that and trying to create access points to improve the health of the communities.
Yeah, and the last piece on the population health, and this is something that again was very important to both SCA and our physician partners, is having the ability to align with a health system that is focused on value-based care. And so many standalone ASCs don't have the resources, relationships, lives to actually enter into value-based or risk-based arrangements. And that is something that our facility is very much interested in. And so again, it continues to be an evolution, but as Hartford continues to be involved at the center and hopefully gets governance control here, we can start to enter into some of these value-based arrangements that really will generate material savings.
So I just have a quick follow-up on that. So you had mentioned, you had actually testified earlier that, in order to reap the benefits, Hartford Healthcare has to have control. Is that what you mean? Is like, in order for these advanced benefits and like such as population health control and all the other like Epic and all this stuff, Hartford entity has to be in control prior to being able to have access to these type of services, as opposed to Hartford being the minority owner at this point, or at 36%.
Yeah, I think it's more about the long-term commitment to the facility and how they would view this multi-specialty surgery center as a part of their network. And so Donna can certainly give more color, but my understanding is, the governance control piece is critical to demonstrate clinical integration. And there are many elements that come along with being a clinically integrated facility, many of which we're discussing here, the value-based contracts, the Epic implementation, and some of the other value that Hartford brings as a clinically integrated network.
Yeah, and without governance control, we are not able to make those decisions that are critical. If SCA decides not to go live with Epic, those patients who go there, their information does not go anywhere. It sits within the surgical episode. Yes, the patient can share with their PCP, but often, as we all know, a story changes as you repeat it. You might forget a detail that happened. And so it doesn't meet our mission and vision. I mean, to be able to improve the health of the communities that we serve. So it's really not the right thing to do for the patient. And that's where our voice will be driving those decisions with the governance control.
Okay. All right, thank you. Sorry, Annie, go ahead.
Thank you. In the application on page 23, the applicant states that there are going to be no changes in services or patient population are expected with the proposal. And they also state that there is no new equipment or service being proposed. The question is, where's the improvement then?
So I would say there's definitely incremental value to the services that we're already providing today. And so I think a good example of that is many of the physicians that have been willing to migrate their cases out of St. Vincent's HOPD and potentially more complex cases inside of a specialty where we're already providing services today. And then, I do think this is certainly an evolution, so maybe nothing planned today, but as we look at this relationship long-term, I think the advances in technology are certainly coming fast and furious, and we want to continue to remain a leader in the outpatient space. And so there will likely be a point in time in the future where we have to work closely with Hartford to ensure that we could have access to the right level of technology. So I think that is something that certainly could happen when you look at more of the mid to longer term relationship.
And Annalise, if this is Jen Fusco, if I could just comment from a legal perspective, I think you're referring to the questions that asked about documenting the need for new equipment and services, or, you know, providing incidence and prevalence data with respect to new services. I mean, I think those were answered that way because there's no equipment acquisition that is the subject of this CON. There is no addition of services here that would require CON approval. So I think that's why we answered those discrete questions that way, versus suggesting that there weren't going to be enhancements to technology and services.
So OHS is actually going to be asking for another late file. We're looking for a revised CON financial worksheet submitted as part of the original CON application. Specifically, we're looking for the inclusion of the most recently completed fiscal year and the projection for the forward, at least 3 years, fiscal years forward.
Okay.
We'll go over these. I'm sure these will sound familiar to Attorney Fusco. I think some of them were from the last hearing.
That's fine.
On page 17 of the application, the applicant states HHC capital will be available going forward to finance the purchase of new equipment and technology to assist the center in attracting physicians and patients for their outpatient and surgical procedures. Since obtaining a 36.0009% indirect interest in Scfc, has HHC expended capital on enhancements of Scfc?
Not at this point in time. We have made some capital investments at the partnership level through kind of ordinary course of business, budgeted capital expenditures that Hartford has obviously shared pro rata in those expenses as an equity holder. But at this point in time, those are the only capital investments that have been made.
All right. Is there any specific reason why there have not been any capital?
You know, Hartford Healthcare wants to partner and make sure that the centers are operated with making sure our vision and mission are realized. And without that voice and control, we are not able to guarantee that to happen. And so we would need to, you know, reevaluate, you know, that request and look at our other partners' needs and prioritize them appropriately.
And I know you were asking specifically about capital expenditures, but there have been certainly some instances with medication shortages and supply shortages where we've been able to partner with Hartford to ensure that we had what was appropriate for various cases. And so again, not capital, but definitely has been a tremendous value to the facility.
So again, on page 17, the applicant states HHC's investment in Scfc will help preserve the center as an alternative to hospital-based outpatient surgical services in the area. This application is about governance control rather than HHC's investment. So will HHC pull out if Scfc if the application is denied?
So at this time, no, we would not pull out. But once again, if we didn't have that voice at the table, as well as the decision making, the governance to make decisions, control to make the decisions, we wouldn't be able to really move our vision and mission forward. And therefore we would, you know, once again, you know, continue with however we can to best meet the needs of the greater whole of Hartford Healthcare and those partners we work with.
Yeah, and I would add to that, I mean, this is a two-way street. And so I think from the perspective of SCA and our physicians, if we're not really able to realize the full clinical integration that we're seeking, I think it would also be a consideration for our physicians. It's very important to us that we could be aligned with a clinically, high quality, clinically integrated health network, start to move closer into value-based care arrangements, and many of the benefits that we're looking to get through this relationship. So I would say that evaluation is certainly a two-way street.
Thank you. Since obtaining a 36.0009% indirect interest in SCFC.
Annie, can you just speak up a little bit? I'm sorry. It's-
Sure. Since obtaining a 36.0009% indirect interest in SCFC, has SCFC begun participating in HHC system quality initiatives?
Yes.
Has HHC begun sharing data with SCFC on outcomes and best practices?
Yes.
Yes.
Has SCFC been able to access HHC's infection control protocols and collaborate on root cause analyses in the event of infection?
Yes.
Have HHC and SCFC begun collaborating on information security protocols and cyber threats?
Yes.
Has SCFC begun participating in HHC's disaster preparedness drills?
Yes.
Has HHC given SCFC access to and the ability to evaluate new technologies?
Yes, we haven't really had a need up until this point, but it is available to us.
Have SCFC and HHC begun coordinating patient care through their relationship, sorry.
Not to the extent that we are hoping for. I mean, we're seeking full clinical integration and we're not to that point yet. And we can't get there unless we have the governance control.
And then has SCFC begun investigating or potentially participating in emergency quality-based payer initiatives?
Can you repeat that question?
Sure. Has SCFC begun investigating or potentially participating in emergency quality-based payer initiatives?
Annie,
Yeah.
did you mean emerging or emergency?
I'm so sorry, emerging. You're correct. Sorry.
No,
Sorry, no
all
worries.
good. Yeah, so I would say to some extent, the investigation piece, I mean, it's certainly something that was at the core of this partnership. And so there has been a lot of discussions around value-based arrangements, but we to date have not yet entered into those.
So since obtaining a 36.0009% indirect interest in SCFC, has SCFC begun participating on HHC's Clinical Quality Council?
I don't think so. No.
So that would only happen with the 3 seats?
No, it's available to them now, but we haven't had the opportunity to, they haven't used it at this point,
Okay.
the opportunity.
Okay. On page 17 of the application, the applicant states HHC will also work with SCFC in measuring patient satisfaction and evaluating and implementing best practices and quality improvements. Since obtaining indirect interest in SCFC, has this happened yet?
Yes.
We do, yeah. We do collect the patient satisfaction information, data, review it, analyze it, discuss it, and adjust.
And did, when prior to HHC's affiliation, was the surgery center collecting this patient satisfaction information on its own, either through SCA or on its own?
Yes, they were.
Okay. Has that changed at all then since the HHC affiliation?
Yeah, The center has fairly high patient satisfaction scores. I think it ebbs and flows on a month by month basis, but we can certainly provide that information.
I don't know if that's of interest to Annie and Steve. I don't think I have a need for it, but
No, I don't think we need it.
if you believe that there has been a marked improvement in terms of patient satisfaction since the HHC affiliation, maybe that would make sense to provide. So I guess we could ask for that as a late file.
Yeah, I mean, I can tell you there hasn't been significant improvement. This center consistently outperforms the national benchmark for patient satisfaction, but I think the better indicator is that we just have we're getting access to more patients through the relationships to some extent, or through payers implementing various policies to encourage patients to use the lower cost site of service. And so we just have the opportunity to reach more patients. So less about the scores and more about the number of patients we're able to impact.
Steve, do you have any thoughts on that?
I think it would be nice to get a payer mix update before and after. Maybe we can see the improvement there. And I know this application was filed a couple of years ago, so it probably is outdated. So I think an revised payer mix table would be appropriate, and maybe you can include some data in there that shows pre and post merger.
Sure.
Some of the changes that have taken effect due to some of the policies that have taken effect as part of the result of that change of ownership. Well, we'll make that a late file.
And Annie, do you have any other questions?
I have one more question and then we can turn it over to Steve. E-license list and inspection report, plan of correction, and statements of deficiencies. We are asking for late files to be, please provide copies of those. And then we are also asking, though, if there are any outstanding quality related issues that are currently before DPH.
I'm sorry, I missed the first part, Annie. So you're looking for updates to the reports that we had disclosed in completeness?
So the e-license has the inspection report, plan of correction, and statement of deficiency. So we are looking for those as a late file.
For the most recent inspection, because I know that when we answered the completeness question here, I think we were still pending inspection. We were still kind of in that COVID delay period. So you're looking for the one that, okay, understood.
That's correct, yeah.
And then the question that I have, though, for now is then, are there any outstanding quality related issues that are currently before DPH?
There are not.
Thank you.
All right, Annie, you're all set, right?
Yes.
Thank you. All right, so I'm gonna, most of these questions are the following questions will focus on the access. And the first question, which will have multiple parts, is that as part of the Exhibit A, which is the C1 application, on page 23, it stated that, and I quote, SCFC has historically provided surgical services to Medicaid recipients and uninsured patients. This will continue to be the practice under HHC governance control. Both SCA and HHC will have a history and HHC have a history of non-discrimination in the treatment of patients at their facilities, statewide and nationwide. Scfc currently serves patients regardless of income level, race, ethnicity, or disability, and this will continue under the governance control of nonprofit health system, end quote. So the first question related to that is, SCA has a policy titled non-discrimination in the treatment of patients. How long has this policy existed?
I believe since the inception of SCA being a part of the facility, but we can double check that.
Okay, and but it was prior to Hartford Healthcare.
Yes,
Okay,
absolutely.
that would be good. Does SCA implement a charity care and or financial assistance policy at its other facilities? And for how long has that been in effect?
Yes, all of our facilities in the state of Connecticut have a non-discrimination policy and a charity care policy. And again, those date back to basically SCA's involvement in each respective facility.
Okay. When did SCFC's implementation of SCA's financial hardship charity discount policy that was provided on page 30 of exhibit D at page 313 go into effect?
Similarly, since really SCA's involvement in the facility.
When did SCFC become a Medicaid provider?
I don't know the exact date. I think it's something we could find out, but I know I've been working with this center for 9+ years, and we have certainly been participating with Medicaid in that period of time.
Okay, that's fine. Does SCFC have its a charity care policy similar to this prior to this affiliation? It's because it was part of the, it's been there since inception, right? You had stated.
The charity care policy.
Yes, it has.
Yeah, sorry, I jumped back to a question. Thank you.
So, Steve, I don't know if you got an answer to your question. What the question was, did the surgical center have
It's similar policy.
something like that prior to SCA's involvement? Is that what you're asking?
Yes.
I unfortunately cannot speak to that prior to SCA's involvement. Would you know,
Oh.
Jen?
Before SCA got involved in the facility?
Yeah.
I don't know. I mean, it's possible they didn't, but we'd have to go back and look at old CONs.
So I'm sure.
I don't think that's really
No.
necessary.
No, I don't think, and again, if it's something, it might be something we can pull from our records if we from previous CONs ourselves. Thank you. Is there any reason to think that SCFC will stop accepting Medicaid recipients and indigent persons if this application is denied?
No, but through Hartford obtaining governance control, it ensures that the facility will indefinitely participate with Medicaid charity care.
How so?
As part of their nonprofit status, I believe that's a requirement.
Okay. But if this is not approved, so you're saying there is a possibility that the facility may stop accepting Medicaid recipients?
No, I mean, we have no plans to do that. We've, again, since SCA's involvement, we've always participated.
Right.
And so we plan to do that into the future. It's just making the distinction that as Hartford as having governance control, that it's
Required.
a requirement.
Got it. Thank you. In the CON application on page 23, it states that the proposal also promotes the use of ambulatory surgery services as a lower cost alternative to the hospital-based outpatient surgery. This proposal will provide patients with more flexibility in selecting treatment options and further ensures that patients will receive this care in the most appropriate and cost-effective setting. How does this change in governance control result in this matter?
I'm not sure that it necessarily changes. I think the surgery center will continue to remain the lower cost site of service for patients that have choice in surgical care. I just think it expands our ability to reach more patients And through this clinical integration effort, I think it will bolster the quality of care that we're providing, because we'll, again, be able to be involved in the full continuum through the relationship with Hartford.
Okay, thank you. In Exhibit D, that was the response to the completeness letter 1. It states HHC's participation in the center will allow it to expand its capacity needed to meet the growing demands of ambulatory settings as an alternative to a more costly hospital-based outpatient surgery. If there is a growing demand for ambulatory setting and Scfc appears to have sufficient capital to address this demand, why is Hartford Healthcare's having governance control necessary to expand this capacity?
So the governance control goes back to us. Hartford Healthcare is a non-for-profit, maintaining that status and assuring that we provide care to, once again, the uninsured and the Medicaid population. And so we can't do that without governance control. And the impact on patient care is really, if we keep those cases at the acute care hospitals, they're more costly. There's higher infection rates. There's increased readmission rates, increased return to surgeries. I mean, this is in, the literature, it's been studied. And so why would we continue to provide care there when, if safe and high quality centers are available for our patients? And in Hartford Healthcare building their ambulatory network of care, we need that piece. We need the surgical ambulatory side, which we don't have today. And governance control allows us to continue to, serve the populations that we care for.
Yeah, and the one thing I'd add to that is around the governance control is our partnership wants to be viewed as a core part of the clinically integrated network that Hartford has. And without that control, I mean, the center could get deprioritized from an investment perspective. And so, we think the best care is obviously delivered as a part of an integrated care delivery system. And we don't want this facility to be out on an island. And without the governance control, we can't be deemed as part of the Hartford Clinical Integrated Network.
So it's a more matter of priority for Hartford Healthcare, where they would be referring patients to a facility that's more governed, they have control over, versus a facility they only have membership or part of ownership in.
Yeah, and I don't think it's necessarily about referrals. I think it's more about just the investment piece. And when I say investment, I mean investment in time, investment in clinical protocols, investment in value-based care and contracting, and investment in strategy. And so, again, I think we want to ensure that this remains kind of core to Hartford's mission and vision. And for those reasons, it's why the governance control is important.
Right. Thank you.
I wanted to go back to Steve's question. So I think you mentioned expansion of capacity, and I think sort of, I'm not sure either of you really addressed that specifically. So why is Hartford Healthcare's governance control necessary to expansion of capacity? Would SCA not be able to do that on its own, or with the way things are currently? Does that make more sense?
Yeah, I think I'm tracking with that question. So for us, I mean, one, our facility certainly has a capacity to take on more physicians and case volume. But I think when you look at what we've been able to accomplish over a short period of time of migrating cases out of St. Vincent's to the facility, much of that, I mean, many are independent physicians that have just opted to continue to provide services in the hospital outpatient department because they're more comfortable in that setting. much of which is attributed to being affiliated with a high quality system like Hartford Healthcare. And I think through this relationship now and having Hartford aligned into the facility, many of those providers are now much more comfortable migrating those eligible elective cases out of the HOPD to our facility. And since the inception of this relationship, we've seen upwards of about 250 cases that are, completely eligible for the ASC setting migrate out of St. Vincent's HOPD.
Okay, thank you.
All right. The next group of questions actually has to deal more with cost effectiveness. Is SCFC at risk of closure due to financial or any other reasons?
Not at this point in time.
Does SCFC currently charge any facility fees?
Yes, all freestanding ASCs charge a facility fee to obviously cover our overhead expenses and staffing, supplies, et cetera.
Is that expected to increase in the average facility fee that's assessed?
I believe in our filing, standard 2 to 3% increases is typically what we project. Again, I think there could be some additional modest increases just tied to inflation, but that's at this point how we're projecting.
And those, I think to clarify, you're talking about year-over-year increases, not as a result of.
Oh, yes,
transaction, sorry, just to
year
clarify.
over year increases. Correct.
Yeah, that was gonna be my question, next question. And just to clarify, that was all. So can we get that as a late file, is some sort of a projection that can provide the average facility fee that's gonna be assessed by SCFC per patient for each of the 5 years, including year to date?
Oh,
Yes.
Could you also just do, and maybe we can do this verbally, but can you define the facility fees? What is being charged? What's the purpose? How's that being defined? What's included in there?
yes. Oh, you mean in the late file?
You can do it verbally, but I think that would probably be best to have that written as a part of the late file.
Yeah, we could do it. I mean, I think you mentioned a few things, but we could add that to the written, what it covers.
Yeah.
We can supplement what she specified to already in the written if that works.
Yes, I think that would be the best. That can be part of the same late file.
Yep, okay.
Projections, and then provide the definition for what's included in the late file. And if you can also just, clarify how that would be different than a hospital. All right. All right, so next question. In the CON application on page 32, it stated further, HHC is exploring bundles of both commercial and Medicare Advantage in all settings, which could potentially further expand the center's participation in value-based care. Has this resulted in any changes at SCFC?
At this point, it has not, but it is something, again, that's of the utmost importance in this relationship, that our center could begin participating in value-based care arrangements.
Okay. On page 22, it says promoting planning that helps to contain the cost of delivery to healthcare services to its residents. SCA and HHC's joint venture ownership, operation, and management of SCFC will ensure that the center remains available as a lower cost alternative to providers-based outpatient surgical care for residents of the service area. So this is given. How will HHC acquiring governance control improve cost effectiveness specifically?
Gina, were you going to say something?
Yeah, I'm happy to, kick it off. Or yeah.
Go ahead, you can go ahead.
Yeah, okay, sorry.
Sorry.
It's hard when we're not in the same room. Yeah, so I mean, I think it, kind of going back to one of my former responses, I mean, I think generally known that on average, surgery centers are 40 to 50% less expensive than the same services provided at a hospital. But through this relationship and governance control, I think it's more about being a part of the clinically integrated network. And again, creating the comfort around Hartford healthcare, the quality they deliver, to get more physicians comfortable utilizing a freestanding site of service through this affiliation, which is gonna, again, enable us to do more cases at the facility, more complex cases at the facility, and then continue to evolve into, again, I think, Medicare continues to add various procedures each and every year that we can continue to keep up with the Medicare approved procedures that are being approved annually.
I think from the ambulatory perspective, and Hartford Healthcare is interested in really impacting the overall cost of care within the communities the patients live. And without an option, a viable option for surgery, we wouldn't be able to offer that to our patients. Also, just in the reduced cost avoidance in reduced infection rates, reduced readmission rates. The $3 billion a year we spend in addressing post-op infections. They're much lower in the ambulatory center outside of a hospital. So the hospital-based ambulatory centers have those high readmission rates and infection rates. And you're cohorting patients who are not ill, but they, need to return to a previous state. They're going for surgery. And the patients at the hospital are ill. So it affords them the opportunity to be in a space that really is the right place for them to get the care they need.
And I get that, but how does the actual governance control affect that?
Because we're going to assure that it is truly stays as a quality, lower cost option for our patients. We know that we have patients being seen today in the hospital, and just by migrating those patients to the ASC, we're lowering the cost generally in that community for surgical cases, because it's a much higher cost in the hospital than it is in a ASC. And with governance control, we can work with our physicians, once again, to try to pick the appropriate cases, to move them to the right centers, and the physicians, once again, have the confidence, because they've been working with us to do the right thing for the patient and move those cases. So, I mean, we are adding to the overall decrease in the cost of care in that community by doing so.
Okay, so that's prioritizing them to the outpatient surgical facilities that are under Hartford Healthcare's governance control.
Yes, to the appropriate center, yes. That is part of our network, once again, so that we don't have freestanding surgical episodes that just sit there with a lot of patient information that can't be, accessed by their providers. So the clinical integration is so critical for all of these things to be realized.
And that access has to be more than viewable.
Correct, for full, yes, clinical integration, because the physician who took care of the patient at the surgery center and is viewing a chart can't put an order in, can't make a note so that their primary care next week when they go to see them, because they had an irregular heartbeat, those details is on a piece of paper. Hopefully the patient doesn't forget it, drop it. Will they go to the appointment? You know what I'm saying? So it's very important for that clinical integration. And Hartford Healthcare has the clinical and the IT competencies to help an ASC that's standing alone to build the infrastructure they need for that clinical integration.
Okay, to that point, what is the current practice of, what is currently being done since the affiliation? This is, the Hartford hasn't had a governance control yet. So how are the doctors that are currently treating patients at the surgical facility putting in their orders and sharing information with the primary care doctors?
It's a paper, communication, getting a discharge summary. But it doesn't go into the detail of the surgery. There's no post-op note that's sent home with the patient. It's not appropriate. It really is a provider view. Yes, the patient could read it, but they might not understand it without the guidance of a professional with them.
Okay, so currently there is no electronic system at that, other than the viewable one, that the surgical center is using. It's all paper.
That's right.
All right, thank you.
I'm sorry, just,
Go ahead.
so there's no EHR at SCFC right now?
There is not.
Okay. And Ms. Sassy, I think you mentioned something about sort of cost containment and cost effectiveness as being community-wide rather than like per instance or per treatment episode.
Yes.
So without the change in governance control, are you saying that discharges from St. Vincent's or any other affiliated HHC, or sorry, not discharges, referrals to HHC, excuse me, let me back up. Are you saying that referrals out of hospital settings that are affiliated with HHC would not be directed towards these surgery centers?
I'm not saying that the providers bring the patients to the centers, and we work with the providers to appropriately migrate the patients to an ambulatory center if that's where the physician is working. But we don't have any direct referral ability. I mean, we go and consult with the physician, and based on, once again, the guidance from the payers, we help them migrate safely those cases.
Yeah, and I think it's
governance
more about the
controls.
access to information from a care coordination perspective. So today it's obviously lacking, given we only have read-only access for providers that are accustomed to working in the Epic EMR. And so we are limited in our capabilities today.
Okay. All right.
And with, and quite frankly, over time, they have not changed from a paper chart. And Hartford Healthcare with governance control can bring that type of, make that decision, at the right time, and make sure it's realized with the governance control.
Okay.
All right. In the application on page 26, 27, cost effectiveness discussed in terms of ASC versus HOPD. No discussion of how this change in governance control will actually improve the cost effectiveness. Where is the proof that the proposal will improve cost effectiveness? This is kind of following up on the previous question, just trying to be more specific in this case.
I think it's more of not a specific patient, but more of a group of patients that would normally have their case traditionally at an acute care hospital that costs more for the payers, for the patients, higher copays. And that group of surgical cases is being moved to an appropriate lower cost care. So, I mean, it's collective plus individually for those patients.
Right.
Yeah,
And that, I'm sorry, just a quick follow-up. And can that not be done without the governance control?
We can't assure that the physicians will migrate those cases out. We know that it's not good for our patients to manage their care. We can't have them, not having an access point for ambulatory surgery that isn't part of our network so that we can provide that coordinated care. It is critical to the patient. If we put the patient first, it's not good care when we can't talk to each other. We can't share data.
Yeah, and I think the patient perspective is critical, and I think it's also the perspective of the provider. And so there will be a higher level of confidence if we are viewed as part of the Hartford clinically integrated network, which is why the governance control is so important. Again, I think we've already are starting to see migration of cases out of St. Vincent's HOPD to the center, which is a cost savings in itself. By our calculations, we've already estimated upwards of $100,000 in savings just from shifting cases to the appropriate site of service. And those cases are coming because the doctors have confidence in our alignment with Hartford Healthcare. But again, they want us to be a part of this clinically integrated network. And without the governance control, we can't get there. And so I think, again, that's one of the biggest components to how we're delivering cost savings to the community, to patients, to payers, to employers, is actually getting these cases out of the hospitals, ensuring the patient's comfortable doing that, as well as the providers.
And the assurance that you mentioned, that is more by providing the physicians that will be referring the confidence to be able to refer to a Hartford Healthcare owned facility.
That's right.
Okay. All right. In the application on page 29, SCFC will also, it stated that SCFC will also be integrated with the care coordination activities of Integrated Care Partners, LLC, shortened for ICP. A physician-led clinically integrated organization affiliated with HHC. Has this already occurred?
Can I ask you to repeat?
Go ahead.
Yes, I need that too.
Could you repeat the question? I'm sorry.
Sure. On page 29, it was stated that SCFC will also be integrated with the care coordination activities of Integrated Care Partners, LLC, which is a physician-led clinically integrated organization affiliated with Hartford Healthcare. Has this already occurred? Has this begun?
Has the integration already begun?
We are the facilities participating in ICP. I would say we're on an evolution to kind of full participation and coordination across ICP.
So what type of example, can you provide some examples of the current participation?
Donna, do you want to take that one?
I would like to a chance to respond at a later time, or could we do a late response?
Sure.
Okay.
Sure. If you can provide as a late file examples of integrated examples of the participations with the Integrated Care Partners, and also if you can put list when it actually began, that would be helpful.
Thank you.
Okay, in the Exhibit R, which is the SCFC's pre-file, on page 393, it states that SCFC and HHC are actively facilitating the migration of surgical procedures from hospitals to ASCs. Between September of 2021 and July of 2022, the center has performed nearly 240 surgical procedures that would otherwise have been performed in the more costly HOPD setting, resulting in a savings of approximately $790,000. As previously noted, migration of patients to lower cost ASC settings is being driven in part by payers who are looking to reduce healthcare costs by directing their members to the most cost-effective, clinically appropriate setting for their care. A vast majority of the savings at Scfc are attributable to procedures migrating from HHC health system, primarily St. Vincent's Medical Center in Bridgeport, and are tied to HHC's partnership with the center and the confidence that the relationship between the two outstanding healthcare organizations provides surgeons and patients considering the center for their procedures. So the question regarding that is, what has HHC's role been in the active facilitation of the migration of surgical procedures from the hospital to the ASCs?
It's been physician-driven. Physicians looking for other options. The acute care peri-op area is very inefficient for an elective case, a scheduled case. They could get bumped because of an emergency. They might have to wait to get, for an elective surgery, they might have to wait a period of time before they have access to the OR and resources. And then once they get there, once again, they could be interrupted by another emergency. Really, it's been driven by the payers as well as the physicians.
Yeah, the other piece, Donna, I'd add to that is there also has been some level of coordination with the right subset of folks, both on the SCA side and on the Hartford healthcare side, to ensure the providers want to ensure that the same standard of care is being met irrespective of where they're performing the case. And so sitting down and just educating the physicians on the standards that apply at the surgery center, making sure that they're confident and comfortable to know that both themselves and their patient are going to have this same exact clinical experience, both from an equipment standpoint, supplies, staffing, policy, procedure. And so there's been some educational element on that to make sure that the physicians are confident when they're actually migrating those cases.
Okay, so to that point, if this is already happening, why is, again, change in governance necessary?
Again, I think it goes back to the clinical integration piece. I think when you look at the universe of opportunities, we're barely scratching the surface. If you look at the amount of eligible outpatient procedures still being performed in a more costly hospital setting across the state of Connecticut, it's quite staggering. And so while we're showing some pretty good early results, we think that once we actually become clinically integrated with Hartford Healthcare, we'll be able to have more of an impact on cost of care. And again, what we're doing today is not without limitations. And so I think physicians are showing a good faith effort because they believe that hopefully over a period of time, we will be a clinically integrated facility with Hartford.
All right, thank you. As a late file, OHS would like to request the names of any and all facilities that Hartford Healthcare Surgery has obtained ownership interest in over the past 10 years. And for each in a similar format, each in a similar format that was provided as Exhibit Z. I'm sorry.
So Attorney Fosco, I think what we're just going to ask is for the same information from the
Yeah.
prior hearing, just be
Yeah.
entered into this one. That way we have it on record.
Yes.
And those are the two questions related to the cost data for the other facilities.
Mhm.
So, you
Would
know,
that be-
rather than have Steve read through those,
Yeah, understood. We can, and if you send a reminder, but it'll be,
yeah,
Virtually
we'll
identical
include
to the
that.
one.
I'll include that in my order. But you didn't have an objection at that point, except to the extent that you didn't want to provide certain information in unredacted form. So I assume the same objection would stand here as well. Is that correct?
yes, and I mean, depending upon how the question is phrased, there were limitations with what we're able to disclose, right? So in that matter, as you'll recall, we were disclosing facilities that were related to the applicants in that matter because we didn't have the ability to disclose other facilities with unrelated partners in them. So those were kind of the two issues, the confidentiality and the scope, which again, if you send something out, we can, for purposes of this docket, raise those same issues in writing for you so you have it here.
Okay. Yeah, I just want to make sure we're being consistent across these three hearings.
And the,
Steve, can I also ask if now's not a horrible time, but could we take a short break?
Yeah,
Do
that's,
you mind taking a just 5-minute break, maybe 5 to 10 minute break?
yeah, we could take a 12-minute break. We'll come back at
Okay.
11:45. Does that
Okay,
work?
perfect.
That's
Okay.
Yeah,
great.
great.
Thank you.
Thank you so much.
No problem.
okay,
Well, I
okay,
just wanted to start with one thing. While we were on break, I tried to sort of reword the two requests for late files.
Mhm.
So I'll just read them.
Okay.
So the names of any and all facilities that HHC has obtained an ownership interest over the past 10 years, and for each in a format similar to the one provided in Exhibit Z for Docket 20-32411. Financial data for both the 3 years prior to and the 3 years after the acquisition, so that OHS is able to evaluate the cost effectiveness of the proposal. So that's one. The second one is in a format similar to the one provided in Exhibit Z for docket number 20-32411. Data from the operation of Scfc from the 3 years prior to the HHC's affiliation to the present. When providing this information and conducting this analysis, the same parameters as Exhibit Z for that docket should be utilized. And do you have, Attorney Fosco, any sort of general comments you'd like to make on those other than the ones that you've already stated on the record?
No, I think I stated those two concerns on the record, and what we'll do is we'll put it together in as close a format, or approximate the format what we are actually able to provide of those, because recall the all payer claims database data comes from payers and exists within OHS. So there's certain data in there that we don't have access to, that we can't replicate in that format. Claims level data about patient out-of-pocket costs, things like that. So what we'll do is we'll provide you with what we can as closely approximated to those categories as we can. We'll explain what we can't provide, and then make our request regarding confidentiality similar to what we did in the other hearing.
Okay, that works. Thank you. And Steve, Annie, do you have any more questions? I'm sorry that I cut everybody off sort of prematurely, but I too needed to use the restroom, so.
Thank you.
yes, I have a couple more questions. Excuse me. And yeah, sorry, and thank you for your patience for everybody who's sitting there and responding. Thought we'd be done sooner, but that's how it goes. And I lost track of time too. All right, so the next couple of questions actually have to do with the impact of diversity of healthcare providers and patient choice. So the transfer of ownership of a standalone facility to a larger entity results in fewer standalone unaffiliated entities. So having said that, can you please describe how this proposal is not a negative impact on the diversity of ASC entities in the geographic region?
Yeah, I don't think there's much of an impact. I mean, if you look at the geographic area, there are an ample amount of both single specialty and multi-specialty freestanding surgery centers in the marketplace. Some are unaffiliated, some are affiliated with other health systems, but I think patients have ample choice in where they seek care in this defined geography service area.
Okay. Can you then describe how less variety in providers does not have a negative impact on patient choice?
I'm not sure I understand that.
So you know, if standalone facility is now affiliated with a hospital, so there's less of a variety of independent or freestanding facilities, how is that not an impact on negatively impact a patient's choice?
Yeah, I think it doesn't negatively impact because there's still certainly an ample amount of facilities in the marketplace. The other piece, I guess, from a patient perspective is typically the physician is the one that is directing the patient to the site of service. And so when you look at our medical staff at Surgery Center of Fairfield County, it's a very diversified medical staff with physicians that have privileges at a multitude of different health systems. So I think there really isn't, in my opinion, any limitations for patients.
Okay, thank you. In the application on page 40, the applicants state that the applicants participate in the applicants anticipate that new surgeons will be added to the medical staff due to the partnership with HHC. Won't this result in a change of referral pattern? Because we've talked about how physicians are the ones that are going to be referring the patients.
Yeah, I mean, possibly a modest change, but I would say that many physicians come to us also because they're getting pressure from payers that have now implemented plan designs that make it very difficult to get elective cases on at hospitals. So I think the change in referral patterns or the modest change is being driven through a couple different avenues.
All right.
And at the end of the day, I think the goal is to get these cases into the most cost-effective, high-quality setting. So it's certainly in the benefit of the patients. But I mean, payers are a big driving force behind this migration as well.
Thank you. So in response to completeness 1, which is Exhibit D, it's stated that HHC's participation in the center will allow it to expand its capacity as needed to meet the growing demand for ambulatory settings as an alternative to more costly hospital-based outpatient center. If this plan is to expand, then wouldn't that impact the diversity of healthcare providers?
I think if anything, it would positively impact the diversity of healthcare providers. I mean, right now, this center, when you look at the services that are being provided, I'd have to say this is probably the center that is providing the most procedures and specialties for elective care. I mean, we've got about 10 different specialties that perform cases at this facility. But I would say that it would just give us access to more physicians, and alongside Hartford Healthcare, the ability to maybe add some new service lines that we haven't contemplated previously. So those cases can also begin migrating out of the higher cost setting.
All right, thank you. Okay, so last, I suppose this is more of a late file. Can you provide a perspective 5-year plan for the surgery center? This should include, but not limited to, details regarding any changes to the services offered, such as addition, enhancement, elimination of services, staffing, and patient referral patterns. It should also include information about the role of the proposed transfer of ownership would play in the ensuring that the plan would, as it would come to fruition. And that can be our last late file.
I think you could also answer that on the record too, if you have an idea or an understanding of what sort of the overall plan is for the surgery center over the next 5 years. I'm sure you don't have specifics, but if there are specifics, that would be helpful, or just speaking in general terms as well.
Yeah, I mean, I think that we're always looking and following kind of Medicare guidelines to see what procedures are being approved at the Medicare level that can safely be transitioned into the ASC setting. And so continuing to evaluate either advanced technology and or new service lines such as cardiovascular, I think is something that, could be something we evaluate over, the next 5 years. But as far as specifics, I mean, I think as far as the value that this center is already and kind of historically has provided to the community, we already provide a wide range of services. Obviously, we accept all payers, federal and otherwise. And we have a high volume of pediatric volume here. So when you look at kind of the diversification of what this center has been able to add to the community, I think it's actually quite impressive. But I do think we'll continue to evolve as the healthcare landscape changes. And that'll be obviously in lockstep with Hartford.
Ms. Sassy, do you have anything to add to that?
I think
I
you're
believe
muted,
you're
Donna.
muted. Sorry.
Okay, sorry. The migration of appropriate cases decompresses the ORs at the hospitals to be able to better serve those patients too. So, I mean, there is a benefit, as we move forward, that should be considered as well.
Okay. So I think we are going to do that as a late file too. That way, if there are any other things that you want to add or more specifics, you can add those. That'll be your opportunity to do that. I don't have any other questions. Steve, Annie, do you have anything?
Not at this time.
Then Attorney Fusco, do you have any redirect, or do you want to take another short break to sort of gather your thoughts and then do some questions?
No, I mean, I think I had a few questions, but I think we ended up getting cleaned up as we moved through other questions. So.
Okay. So we are done early, but we still do need to allow for public comment. Attorney Fusco, I'm going to suggest that you do any sort of closing remarks after public comment. That way, if there's anything you want to address that comes up during that you can take care of it at that point. So we're going to adjourn now until 3 p.m. Sign up for the public comment will go from 2 to 3 today. Anyone listening can either write their name in the Zoom chat or they can send an email to ohs@ct.gov. And then, as I mentioned, closing argument or comments will be heard after public comment. So assuming there is nothing else, I am going to adjourn.
If I can, I'm sorry, if I can just ask, so you did say you want our witnesses to be available after public comments?
Correct.
Okay, and it's possible Ms. Sassy may need to be available sort of remotely by phone, if that's okay, but we can coordinate it. And I'm not sure if you'll be able to get on video, Donna, but you may be in transit somewhere.
Yeah, at this point, I don't know, but certainly every effort will be made to be by video.
Okay.
I'll let you know.
Thank you for letting me know. At this time, I don't think we have anyone signed up, but we do need to allow, from a procedural perspective, that be an option at 3 o'clock. So I do apologize for requesting that you come back, but procedurally, it's just something that needs to happen.
Understood.
Okay, so with all that said, I will see everyone back at 3 o'clock. Thank you very much, and we will see you soon.
Thank you.
Welcome back. For those just joining us, this is the second portion of today's hearing concerning a CON application filed by HHC Surgery Center Holdings, Surgery Center of Fairfield County, and SCA-Connecticut Partners. It's docketed as 21-32423-CON. We had the technical portion this morning, and that ended almost exactly at 12 p.m. Sign up for public comment was from 2 to 3. My understanding is that we don't have any signups from the public. Is that correct, Maida? You are muted.
Sorry, correct.
Okay, thank you. The video, unless I'm misunderstanding, also appears to be focused on you. I'm not sure if that's, can we switch that? Or maybe, okay, never mind. Sorry. It was just an option that I had triggered on my laptop. I apologize for that.
Okay.
I wasn't able to see anybody else, so I apologize. I'm going to just ask if there's anybody present from the public who does want to make public comment at this time, that they just let us know. So is there anyone present who would like to make a comment? Okay. Hearing none, we will move on. So I think we should do late files, and then we can go into closing statements / closing arguments. Does that sound okay to you, Attorney Fusco?
Sure. Yeah, I just have some brief remarks at the end, so whatever works for you.
Okay. So Mr. Lazarus, would you mind just going through them one by one? And I will issue this as an order after the hearing. I know for some of these I've been doing oral orders during the hearing, but I'm just going to transition over to doing these as written orders after the fact. So I will do that either today or tomorrow.
Okay, thank you.
Okay.
So you can begin, Steve.
All right. So we have, this is Steve Lazarus, OHS staff. We have a total of 15 listed here. I will read them through. The first one is information about the physicians currently practicing at the surgery center, including A, the total number, B, their names, C, their specialties, D, whether they have privileges with any other Hartford Healthcare affiliated entities, and E, their employment status. For example, employee professional services agreement, etc.
Yep.
Late file, I'm sorry, was there a question?
No, I just said yes, thanks.
Okay. Sorry, I can't see the screen. I'm just reading off another screen. All right, so item number, late file number 2. Revise and resubmit the CON financial worksheet submitted as part of the original CON application. Be sure to include the most recently completed fiscal year and project forward at least 3 years, fiscal years. That's item number 2. Number 3, copies of Department of Public Health inspection report, plans of correction, and statement of deficiencies. Number 4, provide the average facility fee assessed by Scfc per patient for each of the past 5 years, including year-to-date. 5, definitions of facility fees and the applicants are charging and/or proposed to charge at the surgery center, and a narrative with the explanation of how those differ from the hospital facility fees. Item number 6, the names of any and all facilities that Hartford Healthcare Surgery has obtained an ownership interest in over the past 10 years, and for each in a format similar to the one provided in Exhibit Z for Docket 20-3211, which is the OHS ABCG data for Scfc's primary service area. Financial data for both the 3 years prior to and the 3 years after the acquisition, so that the OHS is able to evaluate the cost effectiveness of the proposal. Number 7, in a format similar to the one provided in Exhibit Z for docket number 20-32411, which is OHS's APCD data for SCFC's primary service area, data from the operation of SCFC from 3 years prior to Hartford Healthcare's affiliation to the present. When providing this information and conducting this analysis, the same parameters as Exhibit Z for docket number 20-32411 should be utilized. That is CPT codes 10004-6990 for surgery. Late file number 8, patient satisfaction data and reports for the 3 years prior to Hartford Healthcare's affiliation to the present. Number 9, update and resubmit the payer mix table, OHS table number 6. And I believe we also had requested an explanation with this that details how this affiliation would affect that payer mix.
I'm sorry, Steve, can you repeat that last part?
Sure. And in addition to the resubmitting the payer mix,
Uh-huh.
updated payer mix table, we also wanted an explanation of how this affiliation has affected that payer mix or would affect that payer mix.
Okay,
There was some, okay,
gotcha, thank you.
you're welcome. Number 10, confirmation of the registered business name for SCA-Connecticut Partners, LLC. Number 11.
And
list- Go ahead. Go ahead.
oh, sorry, so do you want us just to confirm, so the actual legal name is the name that was used in the application, and I have confirmed that it was a Delaware entity. Is there any other information you need? Or is that
Yeah.
sufficient?
Dan, do we need any other, or do we? is that-
No, we
I'll
can
just
take that one off the late file.
Okay.
It's-
Okay.
So the
Sorry, I
new,
meant to toilet.
that's helpful. So the new number 10, that replaces the previous one. List of the CON docket numbers related to SCA's affiliation with SCFC. Number 12, data regarding rates of retention and hiring of medical staff for the 3 years prior to Hartford Healthcare's affiliation through to the present. Number 12, confirmation of the date that SCFC became a Medicaid provider. Number 13, a summary of ways in which SCFC's integration with ICP has taken shape, comma, including when such integration began and the benefits that have been realized to date. And the last one, number 14, a prospective 5-year plan for the surgery center. This should include, but not be limited to, details regarding any changes to A, services offered, such as addition and enhancement or elimination of services, B, staffing, and C, patient referral patterns. It should also include information about the role of the proposed transfer of ownership would play in ensuring that plan would come to fruition. And that's the end.
Steve, can I just clarify with you? So on the new number 10, you just want the CON docket number for when the center was transferred to surgical care affiliates? Back in, I think it was 2007. You just want that one
Yes.
docket number? Okay.
Yep, any docket numbers that relate to the SCA's affiliation with Scfc.
Okay.
It could
I
be
think
one
it'll-
docket, it could be multiple.
Okay. And do you think, I don't know if you have a time frame in mind, but you think it would be possible for us to take 30 days on this? Is that
I
too-
was actually going to ask what you thought would be reasonable. If you think 30 days is doable, then that's fine with me.
Yeah, I mean, I'll let you know if that's not, but it should be, this is similar to what we did in our last hearing. We should be able to get it done in 30 days.
Okay. And are there any other questions that you have about those late files?
No, I mean, we may as we move forward, but, actually, I'm sorry, I do have one question. So for the ones related to the all payer claims database format, Steve, you mentioned some CPT codes, and I think I might have asked you this in a prior hearing. Is there something on the OHS website or you have that defines sort of the exact parameters of what's in that database in terms of what the codes are, which payers are included? Like, I know it's not all payers despite the name, right? So are there parameters that we're supposed to be following as well?
Specifically, no, we don't have any information posted on the website. If you can't, we can get, I'll see what information I can get you from our data team
Okay,
regarding that. But I think those CPT codes sort of provide a general range. But if there's anything specific that differs from those, you're more than welcome to
okay,
provide those and with an explanation.
okay, that sounds good. Thank you.
Okay. So with that, Attorney Fusco, if you said you had some closing remarks, so you could feel free to proceed with those whenever you'd like.
Sure. Thank you. Just brief closing remarks and thank you again, Attorney Chuka and Steve and Annalise and all of the OHS staff for the time you've taken here with us today. I did just want to clarify a few things. It appears from the agency's questions this morning that you guys are trying to better understand kind of what can be accomplished with HHC as an equity partner in this joint venture and what can be accomplished only with governance control of the center, since that's what this CON is for. And I know you've heard a lot about improvements in quality that have begun to take place at the center, you know, the questions that Annalise asked Ms. Sassy, as well as kind of this purposeful migration of higher acuity cases out of the more costly HOPD setting to the lower cost ASC setting. And as Ms. Mondo testified, this is really just the tip of the iceberg of what can be done once full clinical integration is achieved. So your question, at least I think your question is, why, if these things are happening now when HHC doesn't have governance control, is governance control necessary? And as I said in my opening remark, and as others have testified today, full clinical integration of this center into the HHC network can only be accomplished if HHC controls the center's governing body. And it's this full clinical integration that's going to drive the care coordination and the quality improvement. It's going to enable HHC to have say in decisions of consequence that move these causes forward. Like, you know, the example that's been given is implementing Epic, right? Implementing a common electronic medical record that's really going to drive meaningful care coordination. That full clinical integration is also going to provide those surgeons who have sort of started in good faith to migrate their more complex cases to the center, thereby kind of reducing the cost of care. It's going to give them that full confidence that their patients can be cared for at this facility in a coordinated fashion, and that the facility does meet those high standards of care for which HHC is known. And this is why the investment alone is not enough. HHC has to assume governance control of the center, in order to accomplish the objectives of full clinical integration and ensure that the center continues to move forward on this path. So, I'm hopeful that that's something the agency understands based upon the testimony that was given today. I do also want to just touch very briefly on some of the statutory decision criteria and how the proposal, including that full clinical integration, meets the key criteria. I mean, we've heard a lot today, and there's a lot in our written submissions about how the proposal is going to enhance the quality of care. You heard Ms. Sassy testify about the ways in which an HHC affiliation with governance control brings value. It results in full clinical integration and standardization with a focus on high quality coordinated care. This scope of enhancements can only happen with HHC as a full partner, as a controlling partner. It's not something SCA Health can do on its own, and it's not something that HHC can do simply with an equity interest in the center. And so, when we've discussed this at other hearings, this is in my mind the clear public need criteria for the change in governance control. It's to ensure that HHC's mission and vision to enhance care coordination, quality, and access can become a reality. So with governance control, they're going to have a voice for the patients, and they can, coordinate their care across a full spectrum of healthcare services in a way that they can't do without that control. We also spent a lot of time discussing how, answering questions and discussing how the proposal favorably impacts the cost effectiveness of care. You heard Gina and Ms. Mondo testify that, we've already begun to see the migration of these complex cases from the hospital to the ASC setting. Just in the last year alone, we've seen 250 cases and a savings of almost $800,000 to the health system, which is significant. And again, as she said, this is just the tip of the iceberg, that this is physicians in good faith, assuming that this is going to move forward and be an HHC governed center, trying to work together at the encouragement of payers to bring those cases into a more cost-effective setting. So, that is an absolute legitimate way to measure the cost effectiveness of care. And those are real numbers and real savings that are being seen for the system. And then just generally, we've talked about ASCs and how they represent a more cost-effective option. And I firmly believe that anything you do that strengthens an existing ASC and maintains its viability going forward as a lower cost care option enhances the cost effectiveness of care. Questions were asked about Medicaid, charity care, non-discrimination, things that SCA already does and has been committed for many years to doing. But I think the important distinction here is that having a nonprofit health system control this center guarantees that those things happen, right? Because they are a nonprofit health system, those things must happen. And that type of participation is not guaranteed without a nonprofit partner, no matter what the intentions are of the for-profit partner at any given time. So that hopefully that came across in the way that questions were answered. I think there were also some questions asked and perhaps some confusion about how this proposal increases patient choice and diversity of providers. You are now offering patients an HHC controlled multi-specialty ASC alternative in the greater Bridgeport area, an alternative to other ASCs that are controlled by other health systems, other management companies, or that are unaffiliated. So that enhances patient choice. But at the same time, there are still many, many competing facilities that aren't affiliated with HHC in that area. It's a densely populated area for ASCs. And that means that there are diversity of providers, even if this does bring an HHC option into the market. Just other criteria. I mean, I don't think duplication of services is relevant here, given the nature of the transaction, and certainly utilization of existing facilities doesn't come into play because this is a center that's been in operation for 40 years. It's seeking permission to transfer governance control to an existing equity owner. I think it's notable that no area providers have intervened to oppose this CON. Really, the only adverse public comment we've received has come from a physician who uses an ASC in a completely different service area, a facility that incidentally opposed another HHC buy-in in that service area. And I think, you know, this blatantly anti-competitive behavior should be seen for exactly what it is. As far as compliance, consistency with statewide facilities and services plan, I think our CON details pretty well how we've met those criteria, but, you know, some of the guiding principles that I think are most significant are, you know, encouraging collaboration among healthcare providers to develop healthcare delivery networks, maintaining and improving the quality of healthcare services for state residents, and encouraging this regional and local collaboration on healthcare delivery, all of which are accomplished by the change in governance control, which will result in the full clinical integration of the center into the HHC network. And finally, OHS is charged with looking at whether a consolidation of healthcare services adversely impacts cost or access. I maintain that this is not a consolidation of healthcare services. It's a partnership between HHC and SCA Health around an existing surgery center, similar to those that occur all over the state. It is going to increase access to this lower cost care option within HHC's clinically integrated network, which is going to help to ensure that patients get appropriate care in the right setting and at a reasonable cost. So, you know, looking at everything we've submitted, I think it's pretty clear we've met our burden of proof in establishing that the change in governance control meets the requirements of the statute. Approving the CON is the right thing to do for patient care. It validates a proven model of healthcare delivery that results in enhanced care coordination, quality improvement, and that promotes pretty significant efforts to control healthcare costs. So for these reasons, we respectfully request that you approve our CON request. And thank you again for your time today.
Thank you, Attorney Fosco. And thank you, Ms. Sassy, for coming back and being on camera for us. And Ms. Mondo as well. Thank you for being here to testify. That's all that I have for today. I believe that's all that Mr. Lazarus and Ms. Fiala have as well. So as I mentioned, I'm going to issue an order for the late files either today or tomorrow. And for right now, the hearing is adjourned. The record will remain open until closed by OHS, and we will allow approximately 7 days for additional public comment if any comes in. So thank you very much.
Thank you
And
very
Thank you.
much. Thank you.
Thank you.
have a good day.
Bye. You
You
too.
too.